Thank you, Mr. Chairman, and very appropriate for you to hold this hearing on Whistleblowers Day, as Senator Collins has noted. What happened last summer at the VA was a betrayal of our veterans. My state of New Mexico is under the same regional office as the Phoenix office, and the events over the past year eroded the trust they have in the VA. We made a solemn promise. Our vets put their lives on the line for our freedom, and we must ensure that the recent scheduling scandal is never repeated. However, we must note that it was because of whistleblowers who blew the lid on the systemic problems at the VA that we were able to work together in Congress to address those issues. My office has worked alongside VA staff and veterans in New Mexico to refer complaints to the IG. But this process is eroded when whistleblowers are silenced. When that happens, Congress and veterans we serve are not served well. Because of whistleblowers like Dr. Mitchell and Dr. Nee, Congress was able to take action. With the Veterans Access, Choice, and Accountability Act, Congress sent a strong message that VA employees who manipulated scheduling or other data will be held accountable. New management in New Mexico and at the national level, along with new policies, have helped to put the VA back on course, but there is still more to do. So long as mismanagement and reprisals continue, we must continue to do more. We have a duty to ensure that our veterans get the best possible care. When whistleblowers expose problems, that those problems are fixed, and it's been a pleasure working with Secretary McDonnell and meeting with him, and I've had the opportunity to work through some of these systemic problems, and I believe that he's helped restore a culture of transparency and accountability, and I look forward to him coming before the committee again. Thank you, Mr. Chairman. Really appreciate it. Thank you very much, Chairman Kirk, and once again, I just want to tell you how much I appreciate you calling this hearing, because I think one of what you're trying to do is get to the bottom of what really happened, and these two witnesses have exemplified really what the problem is. And one of the things I just want to say at the beginning, I mean, the behavior you describe is just absolutely appalling to me. The lack of care in terms of really realizing that these patients are veterans and they need the best possible medical care, and yet you came forward and you were treated badly because you were trying to expose the things that were out there. To me, this is very, very damaging testimony. Dr. Nee, when you talk about transformative action, I think that's really what we do need. I don't have any doubt about it. I mean, I think that we need to change the culture. We need to change the way of thinking about this. Have either of you visited with the Secretary McDonnell, the new secretary that's come in? Has he reached out to you in any way?
I've met briefly with him, and we had probably a 20 or 30-minute talk. We talked mainly about the issues at the Phoenix VA, and then also the fact that there is no standardized triage nursing protocols for the emergency department in the entire United States. I would not have a loved one go to an emergency room at the VA because it's the luck of the draw as far as the experience of the triage nurse recognizing that the symptoms were difficult. The VA is a national leader in training for physicians. There is no reason why the VA should not establish nursing triage protocols. They're very common in the community, and that was one of the issues that we brought up.
Why do you think they don't, Dr. Mitchell? Why do you think they don't establish these protocols?
I have absolutely no idea. There's very little about the VA in terms of quality patient care that I understand. The VA consistently reported hundreds of cases where patient care was either compromised or was at risk for being compromised. What that resulted in was my evaluations being dropped, me being screamed at by the former chief of staff, me being put on unlimited schedules without compensation. Things that a reasonable human being, if you bring up a patient care issue, you would think that they would do everything possible to correct the situation, acknowledge the problem, and correct the situation. That's what normal human beings do who actually care about patients. I honestly do not understand the VA system. I want to stay within it to work for change because I think it has the potential to be the premier healthcare leader in the United States. But at this point, it makes no sense, and I'm hoping that Congress can inspire some common sense within the VA system.
And when you talk about the things that you've stayed in touch with the VA where you were working as a physician, and stayed in touch with the people, and you say things haven't changed.
Not the culture. People are still afraid to speak up. I have friends within the emergency room that have reported to me strokes that have gone unnoticed by the triage nurse, that stroke protocols are not being fulfilled, that elderly patients with potential blood infections are still being left in the waiting room, that the ER is overwhelmed at times, even with all the new physicians that they've hired. I reported that the new VA emergency room expansion is dangerous. The plans were dangerous when they were enacted, and it's a waste of taxpayer money to build the facility as they're currently building it. I reported so many violations, so many things that needed to be improved urgently, and yet the administration, either locally or nationally, is not addressing it. I came forward mainly, not for the retaliation against me, but mainly to improve the patient care at the level of the emergency department. And again, in all this time, there's been no effort to standardize triage nursing protocols. They have standardized triage protocols for telephone triage. I've heard they have them in the ambulatory care clinic, although I haven't independently verified that. But again, it is strictly the luck of the draw when you walk into an emergency room if that triage nurse has the expertise and training to recognize subtle symptoms that need to be reported to a physician immediately.
That's appalling, appalling. Dr. Need, did you have a chance to visit with Secretary McDonald at all?
I did.
You did? Okay.
I had a meeting with him here in Washington a while back, mostly to address the concern I had with the OIG report and the OIG retaliation against people who come forward. He stated he would look into it and get back to me, which he has not. Now,
did you stay in touch with? I know you're not still a part of the VA now, and you're out in private practice.
I am out in the private sector working.
Yeah.
Correct.
And have you stayed in touch, as Dr. Mitchell has, with folks and seen if there are any changes back?
I have, and it's actually gotten worse at Hines. For the initial allegations I brought forth with the OSC, the OSC wanted the OIG to look into these again. I was interviewed in Chicago in a 2-hour interview by the OIG, but they have refused to provide me with the transcript. They came up with the same conclusion that they did the first time. And subsequently, the Office of Medical Inspector was brought in. Interestingly, the Office of Medical Inspector has preliminarily substantiated some allegations. Unfortunately, the people who came forward at Hines to be witnesses during the Office of Medical Inspection are now being retaliated against and saying that there's nothing that's going to happen at Hines, nothing has ever happened at Hines, and now the people who came forward are fearing for their jobs. So that's a scary message, to have 3 separate investigations by oversight agencies and nothing happened except now your job is threatened. I mean, it really is a harrowing experience to go through and quite frightening if you really want people to come forward to give veterans good care.
From both of your perspective, if you were there and were able to be in a top management position, what would be the first things you would do to try to change the culture as you've described it?
There's really only one thing that needs to change. You have to have accountability and deterrence. I mean, human nature is that people are going to try to game the system, or they may try to do things not to their best ability. And I'm not saying physicians aren't good in private practice, just they're inherently good people, but people work within a system because they know if they don't, there is accountability for their actions.
Yeah, I would agree. Right now, that the administrators that actively retaliate against individuals need to be disciplined. It needs to be made an example. Right now, that type of behavior is rewarded. In fact, the physician chain of command that retaliated against me is still in place, even though 5 physicians told him that the nurses were withholding reports from me, withholding EKGs, slowing down my orders. he absolutely refused to investigate. That is not an administrator who needs to be in a position of power making decisions, life and death, for patient care. Right now, behavior like that is totally, you're immune to punishment if you enact that type of behavior. What happens is the VA settles whistleblower retaliation claims, settles EEO discrimination claims, and there's absolutely nothing that happens to the person that actually enacted the discrimination or the retaliation. That has to stop, and it has to stop immediately. Once you send that message that clearly, then that behavior will stop.
Well, let me just conclude by saying you both chose, rather than the anonymous route, I think, to put your names forward, which is a much more difficult route. But I think you have, through that, been able to really bring out some horrifying stories that I think have had an impact. I mean, for example, the law that was passed in the last Congress. So I appreciate your courage in terms of what you've done, and I just want to thank you very much.
Thank you. I'd like to state, though, when I reported it to keep my name confidential from the people because I feared for my job. I'd always heard that. I expected that they would keep my name confidential. They didn't. I'm extremely concerned with the OIG's latest statement encouraging whistleblowers to come forward. Again, the OIG routine hotline process, even if you keep your name confidential, the report is sent down to the VISN level. The VISN sends it to the facility, or a portion of those to the facility. Facility has full access to the whistleblower's name and can retaliate against them with impunity. Unless the OIG explains itself and can say how it's going to enforce confidentiality at all levels, they should retract their statement.
I agree. When I made my first report to the OIG hotline, I had already known that I was leaving. But within 24 hours, the chief of staff came and told me that if I went forward with any patient information, that he would bring me up on patient privacy violations. So not only did I not have anonymity, I could not come forward with allegations regarding patient care as a physician. And that's a pretty harrowing thought, to think that that's how we're treating people who only want to give good patient care.
Yeah. There is the option to report anonymously. However, what happens is if you report anonymously, there's no one the investigators can get the information from. So you have to give your name if you really want a valid investigation. Unfortunately, in my case, the IG chose not to interview me at all. In fact, no one from the facility has ever asked me any questions. The only thing that happened was the suicide project I was working on was stopped immediately.
Thank you. Thank you, Mr. Chairman.